Schizoaffective disorder. Today we'll be discussing what is schizoaffective disorder. It is a mental illness that is often overlooked because of its similarity to schizophrenia. We will go over the distinction between the two disorders, the types of schizoaffective disorder, and treatment options available to individuals with diagnosis. Similar to schizoaffective disorder, features a number of positive symptoms including hallucinations, delusions, and disorganizing thinking. To learn about these symptoms, refer to previous posts on schizophrenia and the difference between hallucinations and schizoaffective disorder, and diverge from schizophrenia because the individual diagnosed with schizoaffective disorder is also experiencing symptoms of similar mood disorders. There are actually two types of schizoaffective disorder, kind of mood related, in symptoms in individuals, as bipolar type, including manic episodes during which, as an individual, feel euphoric at or have racing thoughts. This is a type of also depressive episodes, though it is not all individuals that are diagnosed with bipolar type will explain depression. The second one, known as depression, only includes significant depressive episode which may in length and intensity, while disorder can be ongenetically. Schizoaffective has been triggered to substance abuse of consumption of psychedelic illegal drugs can put you at risk with this disorder, especially if you have a history of mental illness. Schizoaffective disorder can be overlooked, but in order to diagnose with mental health conditions, you must present both of the symptoms at the same time. This makes the diagnosis really tricky. Symptoms in schizoaffective disorder may be misdiagnosed as having schizophrenia because mood symptoms are not affecting them at the time. Fortunately, this treatment for the two disorders are very similar, so individuals can begin proper recovery even if their diagnosis is incorrect. However, steps available to someone with schizoaffective disorder, which is focusing on addressing both type of symptoms, mood stabilizers and antidepressant, to help balance their mood. CBT, the cognitive behavioral therapy, is supplying useful coping strategies for self-care. Disorganized thinking is confusing. Thinking when confusing is hard to follow speech, along with difficulty organizing logical thinking. Poor person hygiene is a decrease in eye contact, new facial expressions, loses interest of informally active diagnosis. They must have symptoms each day, each above categorizing early warning signs, including poor personal hygiene, withdrawal, depression, extreme
suspiciousness,
decreased range of emotions, poor concentration, unusual irrational statements,
peculiar,
words, symptoms found in psychological disorder. Symptom is important to diagnose must be made by professional mental health. If you are experiencing these symptoms, experience from an experiencing psychiatric nurse's practitioner who can help you understand where you're feeling, why you're feeling, and if you help, and if your provider, your options are to moving forward. I lost interest in sports. Obviously, that is one of the most interesting things I am interested in. But when I got sick, I was no longer interested in sports for 4 or 5 months. And that's what they're talking about when they lose interest in schizoaffective or schizophrenia. First onset. I have found that an antipsychotic has also been helpful to me and that is Seroquel. I've gone through many other medications, and many of them did not cause many side effects. But I have been able to manage, and that is probably the most important part. On Mental Health Day.
So starting with criterion A of schizoaffective disorder, now this can become a little confusing here as well because criterion A of schizophrenia is different than criterion A of schizoaffective disorder. Criterion A of schizoaffective disorder references those 5 symptom criteria, criterion A, in schizophrenia. But these are separate constructs. So in criterion A of schizoaffective disorder, a major mood episode must be concurrent with criterion A from schizophrenia, with 2 or more of those 5 symptoms, with one of those 5 symptoms coming from the first 3. Now, with the major depressive episode, so if the major mood episode is a major depressive episode, the depressed mood symptom must be met. So that's specifically the depressed mood symptom for a major depressive episode. There's another way to be diagnosed with a major depressive episode, and that's diminished interest or pleasure, but that's not qualifying for schizoaffective disorder. Now, criterion B for schizoaffective disorder helps us differentiate schizoaffective disorder from bipolar disorder or major depressive disorder. So with criterion B, delusions or hallucinations must be present for 2 weeks or more in the absence of a major mood episode. So again, this helps us differentiate between a schizoaffective disorder diagnosis and bipolar disorder or major depressive disorder. So more than 2 weeks in the lifetime of the disturbance. So it just has to happen one time where we see the delusions, hallucinations without the major mood episode. It has to be at least 2 weeks. Criterion C helps us differentiate schizoaffective disorder from schizophrenia. And here we see that major mood episode symptoms must be present for the majority of the active and residual phase portions of the illness. Now, what's interesting about criterion C is this allows the diagnosis to change from schizoaffective disorder to schizophrenia and back potentially several times over the course of someone's lifetime. And this isn't considered unusual. So at one point, a mental health practitioner could be working with a client who's had 3 years with the symptoms of schizophrenia, and the major mood episodes been present for 2 years, so that would be the majority. Later on in the treatment of that client, the major mood episode could have stopped, say it could have stopped at 2 years, yet the delusions and hallucinations, what we see typically at schizophrenia, would continue. So say that the schizophrenia symptoms were present for 6 years, and the major mood episode for only 2 years, then the diagnosis would go back to schizophrenia. Criterion D of schizoaffective disorder says that substance use can't better explain these symptoms. So there's also 2 subtypes with schizoaffective disorder. Not specifiers, there are several specifiers, but 2 subtypes. So an individual with schizoaffective disorder would have to be classified in one of these subtypes. There's the bipolar type and the depressive type. So with bipolar type, the major mood episode that we're referring to in schizoaffective disorder would be mania, and with the depressive type, it would be depression. Some other interesting characteristics of schizoaffective disorder. Typically, the negative symptoms we see with schizophrenia, and of course could see with schizoaffective disorder, are less severe with schizoaffective disorder. Also, the lack of insight that's fairly common with schizophrenia, anosognosia, is less severe usually in schizoaffective disorder. Now, the prognosis for schizoaffective disorder is actually better than the prognosis for schizophrenia, which may seem surprising because schizoaffective disorder has the features of schizophrenia plus the mood disorder. The prognosis for schizoaffective disorder, however, is worse than a major mood disorder, bipolar disorder, or major depressive disorder. Another question I get a lot about schizoaffective disorder is, can an individual simply have schizophrenia and bipolar disorder, or schizophrenia and major depressive disorder, and not have schizoaffective disorder? Technically, the answer is no. If an individual meets the criteria for schizophrenia and bipolar disorder or major depressive disorder, then the diagnosis would be schizoaffective disorder. That is really a combination of bipolar disorder or major depressive disorder and schizophrenia. We classify it as schizoaffective disorder. I hope you found this description of schizoaffective disorder and schizophrenia to be interesting. Thanks for watching.